Hey, everybody. It's Q&A time. Unmute yourself, type in, go ahead and fire away.
And go ahead, Linda, then David.
Hey, Miss Linda.
Hey there. Hi. Nice to see you on camera there, Sam, even for a little bit. That was great. Um, Question about mana. You had
Okay.
suggested it to me to use for the up and down with the three brains, and I've started doing that. I was wondering, do I also use it for the advanced Moses technique?
Yeah, you could use it for that. I mean, it's an anointing oil. I mean, it's one of the best ones for bringing in light. You know, they all have their variations, but that one is, you know, there's this one anointing oil, and there's like 3 or 4 different formulas, you know, because it's been around for a couple thousand years. So there's these variations. And so I've made the variations that I'm aware of, and mana is one of them. And so that particular variation, very strong about bringing in the light. Like a lot of times, if I close my eyes and inhale it, I can feel like this, like shaft of light coming down. And so, you know, light being divine intelligence, the creative aspect, and it's a thing that stimulates like movement, you know, any sort of movement or evolving out of situations. And so to go through and work it for the three brains does something for that, but to utilize it for the advanced Moses technique, I mean, it will do something different than like the sage or the hyssop. You know, the sage and the hyssop are both very good cleansers, but they're also for like helping to like purify and detach from whatever is surfacing. Mana won't quite do that, but mana will flush light through all the centers. And you could say that like the energy centers, for them to be healthy, all of them, but the basic, need to be kind of like sharing with each other. And it's a weird way to say it, but you know, because it's light, it should just, like, even if light hits the heart center or the throat center, it should emanate to all the other centers, with them all trying to get into the basic chakra, right? But part of what happens is our chakras don't quite function like that, and so little bits will leak out. But the idea of doing the Lord's Prayer meditation, for example, or a Kundalini meditation, where you're circling the energy on the outer part of the energy body, or the Kundalini in some traditions where they move up and down the central channel. You know, the idea is the same, is to distribute light through all of the energy centers, amongst some other things. But mana would help in that process, like, if that
Okay.
makes sense.
It does. And
Yeah,
what about
yeah,
taking it?
massively. Yeah,
What about
massively.
taking it internally?
Um, Probably better just inhaled and
Okay.
like topical. Yeah,
Okay.
yeah.
Okay.
I don't
Topical,
know.
any
Like, I
particular
tried
place?
taking it internally for a little tiny bit, just a real small dosage. I think I got better out of topical and inhalation than I did out of internal. Yeah,
Okay. When you
like
say topical,
substantially. Yeah,
is there any
just
place
like
in
a few
particular?
few drops on your wrist.
On
Like,
the wrist.
yeah,
Okay.
you could do wrist or you could do heart.
Okay. All
Yeah,
right.
yeah.
Excellent.
How's that
And
treating you, by the way?
well, I just really started with it this week. So
Okay.
it's certainly different than the other oils.
Mm,
And I don't know yet. I'll get back to you on
okay.
that.
Yeah,
Yeah.
yeah.
Yeah. And one more question on the armor of God, right? When we do
Yes.
the green
Hmm.
and then we do the
Hmm.
orange and why do we use blue on the abdomen instead of gold?
You're calming down like an agitation that can happen in that area. When negativity is being projected, it kind of hits your energy body in a couple different places. One is the throat, one is the gut, and then another one is like kind of the sex organs and inner thigh. And then, I mean, stuff comes in through the inner feet, the feet, and things hit the basic chakra. But usually when they're being directed at the person, especially the body, those are the spots that they hit. And blue calms down the agitation in that area the best, you know. Other areas, you know, the different colors do their thing, but the blue has a very calm, soothing effect on that particular area. Just like calms everything down. It calms down the agitation and then the effect on the neurotransmitters and things like that. So
Okay, perfect.
yeah.
I have a friend who is dealing with sleep apnea,
Okay.
and she got a CPAP machine and it's just not working for her.
Yeah.
And we're wondering about using oils or a process or something.
You can try. Like sleep apnea is a little bit hard. This is what you can potentially do is, you know, sometimes it's the little tissue, but you know, at the back of the throat. Sometimes the tension in the neck has tightened down and closed down the diameter of the breathing tube that we kind of breathe through. So a lot of times the best that you can do, like with oils and herbs and things, is try to relax the neck and the throat to like open up and make that passageway a little bit bigger. And so usually a combination of lantana, and you could use either lantana and hyssop or lantana and anise or anise, and just back and forth inhaling them as you go to bed. I mean, it's not going to fix it, but it might ease it up enough. Like I've had some people try it and nothing really changed. I've had a few people do it and they were able to, you know, get enough relief to where the CPAP wasn't necessary anymore. You know, and then to also keep in mind, not so much with oils, but with CPAP machines. Like if the CPAP is not working, there is this, like you have to ask for it. Like they won't just volunteer it, but there is this little device that you wear. It's kind of like a mouth guard, from what I understand. I've never seen one, but it changes the location of the lower jaw, like while you sleep, so it makes it go out more, like,
Mm.
you know, it positions it different, and that opens up the throat, and people can get away with not having a CPAP by using that. But it's a device that somebody has to make for you and the whole bit, because it needs to be individual because of how it's, you know, moving the lower jaw.
Mhm.
I mean, they can try that, but with the oils and the herbs, and like I've even tried physical manipulation and never found anything that worked consistently. You know, I might find something that will work for a couple of people, and then the next 3 or 4 people, it doesn't work. So,
Mm.
like for me, that's like,
Mm.
yeah, you can try it, but I wouldn't say like, oh, that's gonna nail it.
Okay.
Yeah.
All right. Well, thanks for the
I wish I had
insights.
a better answer for that one for you, but I don't.
Yeah, that's okay. It's a tough
Yeah.
one. Sure.
It is a tough one, and you know, it is anatomical, you know, so like here's another variation. Again, I've never known anybody to use this, but like whenever I've gone down the rabbit hole for trying to figure out like different approaches to treat, you know, conditions like this, there was a company that was making a like a smart pillow, and you put your head on it, and what would happen is that when the alarm for the apnea would get triggered, the pillow would kind of move around, so it would make you move your head a little bit.
Mm.
And that movement does something to the neck that reduces the apnea.
Hmm.
And so, I mean, you could try something like that. I don't know how well it would work. You know, I was just looking at it from, I think I saw an article that was probably more an ad than an article, but it was presented like an article. You know how like sometimes people do that.
Oh, yeah.
And I mean, it seemed promising. You know, the idea of having that mask strapped on I mean, I get why they do it, but it's not super practical for most people. Like it's just you know, if it's like something really critical, I get it. But for people who are just trying to have some improvement in their quality of sleep and everything, most people don't usually last very long with using the CPAP. And so, you know, I understand the need to try to explore, you know, different things.
Mhm.
And so I mean I would try. I mean I would try it. You know, I went and got tested for the, you know, the sleep issue, and they said I was borderline and that I could use a CPAP. And I was like, just being honest, that's not going to happen. Like, you know, we can go through it and I can pretend for like maybe 2 or 3 weeks, but it's not going to last. I'm just telling you.
Mm.
And so I looked into the mouth device, and I don't know. Mine wasn't that bad, and if it's not that bad, I was like, I'm not gonna burn a bunch of calories trying to fix this, and you know. But if I had a more serious issue, I would go through and explore those other things.
Okay. Thank
Yeah,
you very much. I will
yeah.
pass all that on.
There was one time, like I'm just like spitballing here too. So there was one time I tried using cinnamon and having the person take it internally. And then we switched to getting these like little, you know how like you do a spray bottle and it does a fine mist. Sometimes you can get these little bottles and it like squirts like a stream of something rather than a mist.
Mhm.
And so I put like olive oil and I think I just did straight cinnamon leaf. And the idea was to open the mouth and then get it to the back of the throat right as you went to bed. And the reason being that so cinnamon acts as a stimulant for body's processes, but one of the things that it's really super good at is it's a respiratory stimulant. So if the respiratory rate is shallow or weak, it strengthens it up. It makes the breath like more firm in the inhalation and exhalation. And
Mm.
the idea was that for people with apnea and when they're sleeping, that the breath, like the rate has like weakened, like it's gotten, you know, a bit more shallow. And so the idea was that I did have good success with a handful of patients, but there was probably 5 handful of patients where it did nothing. You know,
Mm.
so again, like I can never produce like a consistent result, but there was times where things worked. And so I mean that could be something that's explored too, but nothing's like a, you know, for sure thing.
Well, but it doesn't hurt for us to explore it because any one
No,
of them might
I
work
mean
for.
sometimes that's what you
Yeah,
just start doing. You
yeah,
just start hitting stuff and
yeah.
yeah,
Okay. Thank you
yeah.
so much.
You're so welcome.
Real quick question on that cinnamon leaf. Could you do it as a gargle with the same effect?
You could try. I mean honestly with something like that, sometimes you just get in there and start trying stuff and just waiting for something to click, you know, and you know, sometimes it works, sometimes it doesn't. And um, you know, the thing with the cinnamon is we did get results, but it was like probably 35% of the time, which is not a great track record. It's not bad, it's not great. So I mean, it's a thing that you could explore, but it's not something that you go, man, this does this. So,
And then go ahead, David, then Megan.
hey, Mr. David.
Hi, Greg.
Hey,
So I've got a question for you. My adrenals, my doctors told me are a little weak, just
yeah,
recently.
yeah.
So, I was wondering, would the adrenal blend be the best choice for me?
So you have choices here. Like the adrenal blend is quite good. You know, the adrenal support. Sage can be quite good. Just regular plain rosemary can be quite good. And camphor applied topically to the body could be good. Black spruce could be good. Um, I'm leaving something out. Rosemary, camphor, sage. Yeah, well, at least let's start with those. Like any of those just inhaled and applied to the wrist, should be quite good. If you're needing to clean up the kidneys, if are you retaining fluid at all?
I'm not sure.
Okay. Are the legs puffy, down by the ankles, down by the knees?
I don't think so.
Okay, so myrrh can be helpful in cleaning up the tissue of the kidneys, which means also the adrenals. But the adrenal stimulants, which stimulant doesn't mean like it stimulates it like a cup of coffee. Stimulant just means it restores proper function, like it jumpstarts the adrenals to function in the way that they should.
Yes.
Is the sage, the rosemary, the camphor. Basil. That's the other one.
Basil.
Basil is a super good
And
adrenal stimulant.
and inhale and on the wrist, so not internally.
The basil I would take internal. Everything else, the rosemary you could take internal, but usually for that I just use topical.
Okay. Okay. I have all those oils. It's interesting.
Yeah, perfect. I mean, if you have basil, I would be taking basil internally for a lot of different reasons. One is that it does help the adrenals, and it's one of the best like restoratives for the effects of stress. But on top of that, it also has some protective qualities, and it is mental and cognitive like strengthening or stimulant for mental functions. And I mean, who couldn't use that? Like I do it every day. Like I mean, I started even recently doing basil and holy basil every day. Like I like doubled up on my basil.
Okay.
Like it's just there's a lot of good things that happen with basil, but what it does to the adrenals, the mental strengthening effect, and then the impact that it has on stress and restorative to the effects of stress, it's hard to beat, as far as things, and it's super cheap. It's not an expensive oil.
So I wound up getting the frankincense and myrrh blend,
Oh, good. Mhm.
and I tried that a couple times. Should I discontinue that and just
No.
continue those?
I would still do that because the thing with anything that's endocrine is that it's not just the gland, it's a reflection on the whole system. And the frankincense and myrrh is jumpstarting the whole system, but especially the hypothalamus. And I would strengthen the whole and then be specific on where you want to fine tune and make it stronger.
Perfect. Thank you so
It
much.
makes it stronger. Plus, the use of frankincense and myrrh, it helps with pain, it helps with inflammation, it helps with the regulation of cerebral spinal fluid circulation, and it jumpstarts all the glands. Like it's the best stimulant for the glands themselves. But it's like not specific to one, it's like a broad. And if you look at some of what the aging process is, it's inflammation and then like a reduction in like production of hormones and glands, and then the immune system is a little bit compromised. So, by keeping those all nice and strong, you're in theory reducing the aging process or the effects of aging.
Oh,
So again, who couldn't use some of that?
okay, great, great. So like a couple drops of each.
Like I do like 2 or 3 drops of the frankincense and myrrh internally, do like 2 or 3 drops of basil, and then do maybe some rosemary or one of the other ones on your wrist, the adrenal support or rosemary or black spruce, something like that.
Okay.
Yeah.
Okay. Let's see, I got a question. Oh, it was about aging. So this is about aging, but it's
Mhm.
kind of a different topic. Isn't aging really the loss of function and disease always the loss of function in the mitochondria?
I would like if you boil down a process, it's always about inflammation. Like the aging process is an inflammatory process. So then inflammation does all kinds of damage. And so, yes, it would be damaging to that, but it's just damaging to the tissue. It's destabilizing to collagen. Processes start shutting down, everything just starts a downward spiral. So the more that you um, reduce inflammation, keep the glands functioning the best that you can, and keep the immune system strong, fortify the nerves whenever you think they need it. You can slow down the aging process quite a bit.
Okay.
Yeah.
Okay, super. Thank you so
Yeah,
much.
yeah.
Thank you.
And then go ahead, Megan, then Heather.
Hey, Miss Megan,
Hey,
how's
I
life
was
up there?
gonna, how are you?
Doing
I was
good.
gonna ask again about that arm pain, and just kind of if you didn't mind scanning a little more just with the whole like that spot I was talking about, this like upper chest or pectoral muscle or lung, I don't know what it is. And then the neck and everything. So like you told me to do
Remind me what we're talking about.
yeah, so it's this spot on my forearm that's been hurting for like at least a month, and we did helichrysum and eucalyptus citrodora on it. This was 2 weeks ago,
And it's on
and
the inside.
Yeah, she's literally going like
It's on the
this.
inside.
Just like Megan, go ahead and talk.
the
show
spot
her.
is like, are you seeing the camera or?
Yeah, now I can.
Okay, it's like the top of the forearm below the
Yeah.
elbow, like right there. So it's just the top of the forearm right next to the elbow.
Okay.
And I had a lot of like really tight muscles on the right side of my neck that you said seemed to be part of it, and like
Okay.
the right shoulder blade muscle, and it's just been like a big mess over there for a long, long time.
And has it gotten any better or no?
It seems a little better, but some days it's pretty painful, well, moderately painful, and then some days it seems like, oh, maybe it's going away, but then it kind of comes back. And so I just want to try at least one more thing on it. It's not the worst thing in the world, but
Okay.
I'm just curious because it seems like it's connected to like a lot of other emotional stuff that's expelling like up near my shoulder and stuff too. So I'm also kind of thinking about maybe that will help like the old emotional stuff also flush out and whatnot.
Yeah, I'm looking something up. So you just give me a second. Any pain down in the hand or the thumb or anything like that?
No.
Is there pain up in the shoulder?
Not really the shoulder joint area, but there's for a long time there's been like the back of the top of the shoulder. And you pointed out a muscle to me last time that seemed, I don't know, congested or inflamed or whatever, and I forgot what it was called. It's a skinny muscle that goes across the back. So I've just been like doing pranic healing on all the muscles over there, and that the muscles over there are definitely better. They don't hurt as much, which they did for a long time.
Okay, and so the pain is just below the crease of the elbow.
Basically, but more on the outer part of the forearm, the outside of it, like the fatty part, the bump.
Okay. All right. Um, and any pain down into the thumb at all?
No.
And there is pain up on the chest?
Um, not really pain, but I can tell there's just congestion and like it's really stiff and
Is it just below the collarbone?
uh yeah, pretty much. Yeah.
Okay. But no sensation in the hand and no sensation in the upper arm.
Well, my bicep and tricep have been tight for a long, long
Okay.
time.
So there is a muscle called the subclavius, and it, like, if you kind of take your finger and go like right below the collarbone, like if you palpate the collarbone and then go right below it and then go across, that muscle that is right below the collarbone,
Yeah.
that causes radiating pain into the shoulder a little bit of pain right in here, but it makes the bicep achy, and it can make this spot like achy and sore, but it also can cause like very mild issues in these three fingers.
Okay. Yeah,
Doesn't
nothing
mean that it all
very-
doesn't matter mean that it all manifests at once, but those are all the potentials. And so like I would try still doing what you were doing on the forearm, but up here on your collarbone. Like
Okay. So
below your
the
collarbone.
same
Yeah,
oils.
yeah. Same oils. And so like you can sweep that muscle, like just sweep that area below the collarbone and then
Yeah.
rub those and then kind of do like a friction, like you put it on there and then like,
Yeah.
really give
Massage.
it a little good like friction thing. And after half dozen applications, see if that doesn't change the forearm.
Okay.
Yeah.
Thank you. And then could you scan my daughter again? She still
Sure.
has that cough. It has we did the fur balsam and that helped it. It was a dry cough and it was like a really frequent cough. And then it went down less frequent, but now it's mucusy. And now she has a runny nose. So I don't know if she's just cycling through different like little
Yeah,
infections.
this virus has a long cycle that it goes through. Like sometimes when a virus hits, if we can catch it in the very beginning, you can kind of nip all of that in the bud and not let it, blossom into something. But like sometimes when a virus has engaged, you kind of just try to minimize all the phases and stages. And the thing, there's a few things floating around right now, but I'd say one of them, like people are sick for like 3 weeks. And then even after the 3 weeks, they have a little bit of hard time with breathing and coughing and mucus and things. And so I'd say she's probably just running her cycle through that. And remind me of her age. Like she's
She's just about to turn 7. We're in the
7.
3rd month of this.
3 months. That's quite a
Yeah.
while.
But it's just like it's not so bad that like I think I did take her out of school for 2 days when she was just coughing so nonstop. But it's just like it's just this lingering thing. I've done like the camphor salt
And
bath.
so is it dry, or does it sound like there's mucus and she's trying to produce?
Now it's mucusy, and so I tried the terebinth and did a lot of that. Then somebody on a text thread, I'm on this other mom in the neighborhood's like, my child had a persistent cough and she just went to the doctor and got tested for strep and it was strep. So then I started doing, gave her a drop of bay laurel in water and like diffusing bay laurel at night, and it hasn't changed, and trying all the pranic healing. I noticed the jaws and the ears were really congested, so I cleaned that
Yeah.
today. I don't know if that's going to help, and her lungs are just, yeah, they were congested again today, but I've cleaned them so many times, and spleen and basic and arms and legs. And my son is so much easier to treat.
Well, like sometimes people's immune systems are in just different places, and yeah. Okay, what do you have that's like so we tried the terebinth and that helped, but it didn't help enough. So uh
Well, the fir balsam helped. I didn't see a
Fir
change with
balsam helped,
paraben.
but what about like do you have a Nula by chance?
Yeah.
Let's have you start putting a drop or two of Anula on her chest and then have her inhale it out of the bottle multiple times a day. And so, one of the things is like if there is like sometimes it's that there's a bunch of mucus there that was like thicker and more solid and it's starting to liquefy to be expelled out. And sometimes the nose just keeps producing almost like how you would like with allergies, but even worse. And so let's have her inhale the anula to thin down the mucus to help her expel it out or just have it break down and be processed by the body. But it might not stop her cough right off the bat, but it will help produce the reduction of the mucus.
Okay.
And then let's put her on something that has, I mean, do you just give her like any sort of antihistamine or anything like that?
No. You're saying
Okay.
essential oil wise or over the counter?
Either
Neither.
way, either
No.
way. So, um, do you have dark blue tansy?
It doesn't just say blue tansy, or is there more than one type
Well,
of?
no, there's two. But like if you have just regular blue tansy, let's have you give her 2 drops of that, like 2 to 3 drops of that, once a day.
In water?
Yeah, like for size, let's just say 1 drop, 1 drop once a day.
I think okay, I'm not sure I have blue tansy. I know I have blue healer. Is there a second choice if I can't find a blue tansy?
Well, we're looking for antihistamine properties,
Okay.
so
I mean, I have allergy support.
yeah, you could just maybe have her inhale that a bunch.
Oh, okay.
Yeah,
Okay, thank you.
yeah, perfect. Like let's have her do that and then let's see what happens.
Okay, thanks.
And then go ahead, Heather, then Ralph.
Hey, Heather.
Hi, Greg. How are you?
I'm doing good. How about you?
Very good. I've got a new client who's come to me for 2 things. It's mainly mercury poisoning from 2018 and to remove negative energies.
What's the
So
negative energies mean? I mean, I
this
know
is
what you and I would call negative energies, but what do they mean
Mhm.
by negative energies?
Right. So this is where it's a little
Right.
more
Uh,
detailed.
yeah,
The person did some Akashic record session and it says
Mhm.
they need to do pranic healing,
Okay.
but their guides tell them that they have negative energies on the back and it's been there for a while and it may be from the family.
I just get in there and do what you do with pH. Cut
Right.
cords, do general sweeping,
Right.
clean out the solar plexus, clean the basic up a little bit, see where they're at.
That's what I was planning to do, but I
Yeah.
decided to ask about oils because she also mentions having chronic fatigue and brain fog, and I'm thinking, well, gosh, you probably could try some rosemary.
Sage, like yes, sage, rosemary. Sage is very good for brain fatigue. Rosemary, very good for increasing blood to the brain.
And rosemary could be internal, but not the sage. Sage is only
Right, I would just do sage and inhalation and then like
yeah.
on mist. And then rosemary,
Okay.
either way, internal or topical.
And then
I also like when people have chronic fatigue, I also like to do a jump start on their glands. So with pH, you would just
yes.
blast the ajna, focusing on the pituitary.
Oh,
And
okay.
if you're using oils, frankincense and myrrh,
Okay.
topically would work, but internally would be better.
Okay. Energizing the pituitary through the ajna.
Yeah, I mean, you can clean it up a little bit, but it just needs to be juiced up a bit. So
Right.
using
Okay.
like EV and maybe
Right.
violet and then some EV, but like really focus on the ajna.
Awesome. Okay.
Yeah.
And then when I asked about the oils, if the person was using any, it was said that because of the mercury poisoning, all of the oils just bother. So just kind of leave that alone?
Yeah, you could leave
Or,
that alone. Like, this is what I would say about the mercury poisoning, is
Mhm.
that sounds like it's a bit of self-diagnosis, or maybe somebody like a chiropractor or something has suggested that. And so I would go through and treat it, but I wouldn't let that be like the thing that you base your decision on. You know what I mean? Like, you use it to open the door and start looking around, but you might find that what she's calling mercury poisoning is something different, and then treat it like accordingly. Like, you don't need to like straighten it out and say, I don't know if this is mercury poisoning. You just start going down
right.
the rabbit hole and treating the things that you want. But you know, like, I'll give you an example. Like, all of a sudden, this is when I was doing full time. All of a sudden, I started having all these
Mhm.
clients come in with heavy metal poisoning,
Yeah.
and so I was like, man, this is really becoming a thing. And then I started talking to my chiropractor friends, and there was a guy going around teaching workshops about metal poisoning that
Mm,
all the chiros were taking the classes with, and I was like, oh, that's why everybody's getting diagnosed with it. Everybody just learned how to diagnose it and treat it. And
mhm.
you know, it's definitely a thing, but it's not always the thing that is going to produce a result for some treatment. Sometimes it is the thing, but sometimes it might be in the vein of what's going on, but it's not necessarily treating
Mhm.
that is going to make that person feel better. And so, like, I kind of usually will take in the information and get the gist of what
Right.
they're asking. That's why I always will say, like, present me with, like, tell me the symptoms, because you want to know the symptoms more than you want to know their translation or their
Mhm.
evaluation. Like, you still listen to that part, but you want to hear
Okay.
what the symptoms are, because you know WebMD is pretty, can give you a lot of good information, but it's not always
Right.
accurate. Like, they're not always presenting all the things. So, I mean, I would use the information, but I'd also go, but what else could this be? And then just treat accordingly. Organs for
Right.
the heavy metal things. Coriander is really super good for that. But if you're only able to do pH, green and orange on all the organs for blood purification. So lungs, liver, gallbladder, kidneys. Not orange on the spleen, but the spleen.
Right. Okay.
Yeah,
Okay.
just knock
Could
knock that out. That will,
could throw that in.
yeah, reduce quite
Right.
a bit. But coriander is what is traditionally used for heavy metal detox.
Okay. Thank you. Yeah, it
Yeah,
seems like
yourself.
maybe it was the same kind of thing with a naturopath that diagnosed it years ago for this person. And
Yeah, I mean, it can be
yeah,
a thing, but there's
yeah.
people who also think that it's a thing when there might be exposures, but it's not causing the health issue. So, like, the thing that I always looked at it from the point of view of being a practitioner is like, I want to produce a result. Like, and so I
Correct.
don't really care if they come in with inaccurate information. It's like, how can I take that information and produce the best result as possible? And
Mm-hmm.
so, I listen to what they say, but then I ask them other questions, and then I treat what I think is appropriate,
Mm-hmm.
you know.
Right.
And sometimes I still start off with going, okay, let's just treat it like it's heavy metal poisoning. And then after the person maybe responds, you can go, let's keep going down that rabbit hole. And if they don't respond, it's like, let's try some other things,
Mm-hmm.
you know.
Exactly.
So,
Okay.
yeah.
Yeah, and then moving to a different client who
So,
I've,
so can I say one more thing about that
yeah,
client? Because, like, as
yeah.
I'm sitting here with it, so we haven't talked about this too much. We are going to be talking about it in the generational healing, but
Mm-hmm.
like,
Right.
sometimes when you start doing healings with somebody, sometimes the issue is that their body is not in a state for healing. right? Like it's just, it's
Right.
too chaotic, right?
Sure.
So in ceremonial healing and in with essential oils and things, you would use things like different cedars. Like, you could just choose a cedar, have them inhale the cedar, and you know how we do the 4 quadrants where we do the left side, the front side, the side, and the back side. Basically, instead of front and back on the,
Oh.
you're doing all 4 quadrants.
Mm-hmm.
You have them do that with the cedar, and it makes the healing go much easier. And even if you're treating heavy metal and whatever else is going on, when people start to have issues like, oh, I can't do this kind of healing, I can't do that, and I can't smell oils, or there's like multiple things going on, like their body is like too
Mm-hmm.
sensitive or too reactive. I go for the state of the body. I set aside all um uh like symptoms, and I just try to like stabilize the body and put the body in a little bit more of a state of healing, right?
Mm-hmm.
And
Mm-hmm.
so cedar will do that, but even with your pH, you would use electric violet, and as you start to work the aura, you would just say, okay, the aura, like the state of the aura. Like, you don't even have to say negative or positive, just like
Okay.
state, like, is it organized or is it chaotic, basically? And you're just sweeping like chaotic energy off of the aura so that when you heal, it has a better chance of anchoring. And as I sit and think of this
Okay.
person, like for whatever reason, like it could be allergies, it could be, a psychological thing, it could have been an accident, it could have been all kinds of things. But the body is not in, it's just like in a chaotic state, which serious health issues, injuries, all kinds of things can cause.
Yes.
And so I think
Yes.
calming that down and cleaning that up will make the other parts easier to treat. So
Yes.
I
Oh,
just
and
want
there
to
was
throw that
several
in.
concussions
Yeah.
too.
Oh, that's probably why. Yeah.
Okay.
Yeah.
So the
So
pituitary
try
gland would
that right
help.
off the bat and then do
Okay.
your other things and then see what happens. But like, how like sometimes you go, I've done this healing like 100 times and like 99 times it works, and you do it 15 times on a person and it just
It
never
does
does
nothing.
anything. It's the state of the body usually. Like if you go back and just
Okay.
clean up the chaotic energy and then do the healing again, it starts to work.
So the intention is to remove the chaotic
Yeah.
energy and the general
Yeah,
sweeping.
just form the intention of like the state of the body and then just start doing the healing, like doing lots of general sweeping.
Okay.
Yeah.
State of body. Got it. Okay. Just jotting that down. Okay. And then a question about specifics on a protocol, like for psoriasis. I have someone with inverse psoriasis, so that's a particular area of the body. I would think just following the same psoriasis
Yeah,
protocol
I would
would
do
be
the
fine.
same. Yeah, would put a little bit of spikenard on any area where there's an outbreak. And then
Spikenard. Okay.
yeah,
Okay.
psoriasis can be a little bit rough. And so like you start with that, see how the person, sometimes that will reduce it, but sometimes you just got to start rotating through
Yeah,
different things. We have used parsley and black soap, and that has had an impact. It doesn't make it completely go away, but it does reduce it somewhat. And so the combination of the spikenard and the parsley soap seems to do good, but it still
okay.
need work. Yeah.
What what about if the skin is broke open? The spikenard would still be okay, right?
Yeah.
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 And if I guess, like you said, you try this for a few sessions, and if you're getting no progress,
Yeah.
you might want to
Like,
consider switching to like the strengthening and stimulating the immune system.
um, I would probably work a little bit more with like things that are anti-inflammatory, reducing inflammation. Anytime you have an autoimmune issue,
Mm-hmm.
inflammation is always a thing. So Moroccan thyme taken internally can be good. Myrrh can be good. And then things that are anti-inflammatory like black cumin and frankincense and ginger. All of those are good without, like if you use something super strong for the immune system, sometimes you can actually aggravate it because an autoimmune issue like psoriasis is the body is attacking itself. And so if you strengthen the immune system too much, it will attack itself even stronger.
Oh, okay.
And so you want to kind of have like a little bit more of a regulating effect on the immune system, which means like oils that would be very good for stimulating the immune response might be too much for an autoimmune issue, but you can drop down the dosage and then it's fine, right? You can give the same dosage just spread out throughout the day. Like cinnamon's a perfect example. If you took a big dosage of cinnamon and there was a strong autoimmune issue, it might stimulate it, it might not, but if you spread that dosage over a period of time, won't stimulate it at all, right? And you still get the benefit of stimulating the immune system. So I would go with things that have an anti-inflammatory effect, but aren't like crazy super stimulating to the immune system.
I see.
So like,
Okay.
so frankincense, ginger, myrrh, black cumin, yeah,
Right.
things like that. Yeah.
Okay. Shoot, I had a question and I lost it. But you're definitely saying kind of maybe not, instead of, if the psoriasis protocol is not helpful, focus on reducing inflammation,
Mhm.
not necessarily
Yeah,
strengthening the
you're
immune
not
system.
trying to make the psoriasis go away in the
Oh, that was the
session.
question.
Yeah,
That was it.
you're trying
Is it
to change the body so that it stops generating the psoriasis.
I remember the question. So is the psoriasis protocol a cure or just a Band-Aid?
Are you talking about in pH or in?
Yes.
It's probably more a Band-Aid.
Because medical things, WebMD or whatever, will say that it's incurable. You'll have it
It's an
forever.
autoimmune issue, so you have to be able to reduce and reverse the autoimmune issue somewhat. It can be done, but it usually takes very diligent work. So most times you're just trying to manage outbreaks.
Okay.
Yeah.
Managing outbreaks. Yeah.
Yeah. But even if you're trying to make it completely go away, you still have to manage the outbreaks first and then eventually get it to a point where you can like keep doing little steps to eventually get it.
Okay. And I believe the client's taking some type of medication to keep things at bay.
Yeah.
How
Yeah.
would we know? Like, I'm not going to say stop taking your
No,
medication,
I
but
would let them take that. They work somewhat. They don't work totally. So I would let
right.
them have the comfort and relief and still treat it as if.
Because he was thinking, oh, maybe we'll try the protocol for a month and then
No,
maybe
I
I can
would
stop taking it.
have them stay on their meds and
Just stay on it.
yeah,
Okay. Okay.
yeah.
And then his choice would be, okay, things are getting better while I am taking the medication. So maybe this is the sign that the pranic healing is helping to manage what the medication
Yeah,
is
you
not. Is
like
that kind of how that goes?
kind of going back to the chaos thing. The more that there's an outbreak, the more that the body becomes harder to treat. So even if things are calmed down, it just makes it so that you can treat the underlying factors to a greater degree, and you're not managing the outbreak. When you're in the middle of an outbreak, it's really about managing the outbreak and not really treating the condition. So if you can get it calmed down to a certain point, then you can go and do like a deeper rehab on the immune system. But
Okay.
when he's having an outbreak, you just have to kind of manage the chaos for a little bit.
Got it.
Yeah.
Okay. Excellent.
Like you can do green, blue, violet just all over that person's body, like just everywhere.
Over.
You know,
Okay.
the only place not on the basic, but other than that, you're good.
You're saying not on the basic?
Yeah, you don't want to put violet on the basic.
Okay,
Yeah, it will do weird things with the white blood cells.
okay.
Yeah.
Thank you. The other is you had helped before with a client, elderly lady, she's like 70 some, with humming sounds in her ears or in the head that was stemming possibly from the neck. Shit that because there's cervical stenosis, and she's been using a
Oh.
lot of the terebinth.
Right.
She's also had some trigger point injections recently. So
Okay.
things have gone from like humming in the left ear over to the right ear. But I'm wondering if terebinth is still good to just continue using that, on the sides of the necks, or if she should
Yeah,
switch to
she
something
could
else.
be using that. I would almost even do the vetiver like in a roller ball, like all across the base of the skull and even up and around the ear. Just there's a thing called the nuchal ligament in that area, and if you unwind that, it just opens everything up, including the pressure on the vertebrae. And so terebinth is a very good choice, and I probably wouldn't have her stop that, but that she's
Okay.
getting injections and finding some relief, that means that nuchal ligament is probably in very tight and in bad shape. So just all
Okay.
across the base of the skull, like vetiver would be first choice, but like
Mhm.
spikenard, valerian, anything in that nature would be good.
Okay. Sweet. We'll try that. Thank
Okay.
you very much.
Keep me posted. Yeah.
Okay, will do, Greg.
And then go ahead, Ralph, then Chris.
Hey, Ralph.
Hey, Chris, Greg, how you doing tonight?
Doing good.
I have a bottle of Rosalina in my collection,
Oh, wow.
and I've got a thing with continually cold feet. So if I'm going to apply the Rosalina to my feet, would I use a liniment or just
You could just do straight.
okay?
Yeah.
Okay.
Yeah, so the Rosalina, I mean, it might warm up the cold feet, but it's more about regulating the neurotransmitters because of the cold feet.
Mm-hmm.
But it still might warm up the cold feet.
Okay. So cold feet taggets would actually be the go-to.
Targets. I mean, let's try the Rosalina and see what it does.
Okay.
Yeah, let's see what that does for you.
All righty.
Yeah, let's give it a good solid week.
Okay. All right. I noticed in this week's clinical corner, you have aura and protecting the light, and you went into great detail with a lot of oils and locations.
What did I do? I don't remember.
Okay.
What was it?
Clinical corner, aura and protecting the light this week.
Do you want me to send it to you?
Oh, sorry, it was February 5th, not this week, February 5th.
Oh, okay. Yeah.
And
It's the protection stuff. Yeah.
right. And
Okay.
it starts with the
Yeah.
quadrants, and
Mhm.
then you list emotional, and a different series of oils, then mental and a different series of oils. And then it gets down to application. It says lower legs. And then it goes through, a lower leg process and arms and joints and things. So is if we're having a particular issue with, say, lower legs or
I'm
legs?
confused now.
Okay. So
Let me see what I wrote.
yeah, let me
Okay.
get it.
It's the protection stuff.
It's the
right?
protections. So
So
it's
there's
the colors.
So the first four are like the physical, emotional, mental, and spiritual, and you're doing the quadrants of the aura, correct?
Got it. Yes.
Is that what that is?
Yes.
And then after that, we go into
Application, it's called. And it says lower legs, arms, joints of arms and legs, pelvis.
So it's when you go through the colors with us. So we're putting green
right. So
on the arms. and legs.
no, that would be regardless if you have an issue in that area of your body, it's a way to firm up part of the energy body.
Ah,
So
okay.
if you have a issue in that particular area, and actually, we are going to be talking about that quite extensively over the weekend with the class that's a review class for you for the body mapping. We're going to
Okay.
do some other things where we go through different parts of the body. It's
Mhm.
going to be very different. I mean, we're going to talk about some of the same things, but it's not going to be like the last time we did the class. We're
Right.
do more of like a study group and practical applications. And so I would do all the colors, like, the arms and legs and the pelvis and the abdomen and then the chest and the, back and, all that stuff.
Mhm.
I would do that just as a practice.
Okay.
It puts the body in um, a better place for healing.
Mhm.
It strengthens and firms up certain areas of your energy body. A little bit different than just the mental, physical, emotional, spiritual components. Just
Okay.
firms up the energy body in ways that just doesn't let stuff in the environment um, impact you. So
Okay.
it does have a healing component to it. Like there's been times where people have had a bad back or bad hips or bad shoulder. We run them through that process and it feels better.
Mhm.
Um, it still was more for like the protective qualities.
Okay.
Yeah, yeah.
All right. Good.
I think that we're
Yeah.
talking about the same thing,
Yeah,
right?
we
Yeah,
are.
okay.
You're-
Sometimes I write so many different things, I can't keep track of what we're talking about because my brain's been in too many other places.
Okay. I get that.
Yeah,
All right. Thanks.
yeah.
And then go ahead, Chris, then Denise.
Hey, Chris.
Thanks, Sam. Hey,
Hey,
Greg.
hey, how are you?
Hey, I'm good. How are you?
Doing good. How's your husband?
He's good. I think he's
Good, good,
napping now.
good. Lucky guy.
Yeah. Hey, thought forms and sleep. So I have this client. I use the super aloes on
Okay.
her, and it totally helps calm
Okay.
the brain, right? But
Right.
again, it's the AAA. What's a good alternative for overactive mind and thought forms?
I mean, the overactive mind and thought forms could, like, when you're saying thought forms, you're just talking about repetitive thoughts.
Yeah, yeah.
Yeah, that, I mean,
Self-generated.
self-generate. Yeah.
Yeah.
Um, it's hard to say like there's one path to it, and so like you have that component that you're doing. I go back to even the thing that we were talking about with Heather about the state of the body.
Uh-huh.
And doing the cedar on the 4 quadrants can be very, very helpful.
Okay.
It can quiet some of the mind, it can quiet some of the brain. And then the other thing is like things like vetiver or spikenard, even neroli can be used to calm down. I mean, a lot of times, even though that's up in the mind, it's like the basic and instinctive responses. And so the vetiver, the spikenard, the valerian, all of that will calm that stuff down, calm the
Okay.
generation of that stuff down. And so you could try that. But the repetitive thoughts, yeah, there's different reasons why they pop up. And
Yeah,
so
there's a lot
even,
of stuff hanging in the air for her,
yeah,
that's causing worry. And
yeah.
then job has gotten so stressful.
Mhm.
A lot
What's
of
going on?
changes and layoffs
Just
there.
a lot of changes. Is that
Yeah, a lot of changes and things just unsettled.
okay? Well, if you look at anxiety, it's lack of awareness in some area for the person. you know, their lack of awareness on something going on in the environment, something, you know, some active situation, something from the past, even something going on with them internally. And so we could talk about those things that we just talked about. But one of the things that you could do is you could take the, you know, from the last weekend, the astral projection oil, and have her inhale it and then go through the different scenarios that are going on in her life, like the active situations. And if there was a past traumatic experience, have her, you know, put her awareness on that and then inhale the astral projection as well. And so the astral projection is helping with the expansion of the emotional body, but it's breaking down emotional patterns. And
Okay.
it is one of the best emotional cleansers that I've ever made. Like,
Best.
yeah. So like, you know, we knew that, but you know, I don't know, like it was like after, was it last weekend or something, or before the weekend or something, I don't know, in the last week. But Samantha was like, I'm gonna take a salt bath. What should I do? And I was like, hey, be fancy and do astral projection. You know, you're getting ready to go to bed. And so she did it. And then I walked in the bathroom and it felt like somebody punched me in the solar plexus. And
Hmm.
it's like, oh, somebody's upset at me or something. And then I started thinking about it. I was like, no, it doesn't feel like that. I feel a lot of heaviness in the solar plexus. And then I realized it's the bathroom because she just took her bath there. And so I was like, okay, let's just clean this up. I did like 7 or 8 ohms. I was like, not touching it. Like, how bad is that? So I had to burn several sticks of incense. And then I walked out and I said to Samantha, like, how are you feeling? Did something come up? And she goes, no, I feel amazing. Like I feel da 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 da. And you know, I sat and I looked at it. I mean, I knew that it did what it did, but I didn't, you know, I'd never taken a salt bath in it. And it really released a lot, like a lot. And
Good job, Sam.
I would say that when I do the thing with the astral projection and I go to like, okay, active situations, past experiences, it's not even like, oh, I'm releasing it. It's just like, yeah, this is boring. I'm walking away. Like it's just, eh. You know, it's not even like there's like this, oh, I got to release it. Oh, I got to do this. I got to do that. It's just like, no, just feel kind of done. This feels boring. And just get up and moving it out. And sometimes these situations with the repetitive thoughts or the emotions that are too hard, it's just like they're too entangled to be able to walk out of it. You know
Yeah.
what I mean? And I would say that maybe the use of the astral projection in this situation, it's hard to duplicate with regular healing, but using the oil and have them just inhale, come back to their body, think of the situation, inhale, body, situation, and just have them keep doing it, and then sweep them down and just see what comes out.
Okay.
Do that a few sessions and see if that doesn't help.
Wonderful.
Yeah, I think that will.
And would for her, if she orders it, would a roller be better?
Yeah,
Or just
probably a roller. Yeah.
Okay,
I
I'll tell her.
mean, for hardcore students, I would say do a bath in it, but for your clients and stuff, a roller is plenty.
Okay.
Yeah.
Greg, you know the DD
Yes,
DD1 and
DD2,
2?
DD1 or DD2.
Are you? Can you make a kit with all 3?
Sure.
Yeah.
Yeah.
Cool. That'd be
Yeah.
awesome.
Just
And
email
then
me, remind us.
Yeah.
I
Yeah.
will.
Maybe do email me because as soon as I walk out of this room, I will forget.
Okay. And for that, would just like a 5 ml
Yeah.
kit?
5
Okay.
ml roller would be good for. Yeah.
Hardcore people.
Yeah.
Awesome. I
I
love
mean,
the
I've done a bunch of crazy baths. I still haven't taken a bath in any of the DD blends.
oh, that'll be interesting.
Yeah.
Would
He
you
will.
report back to us?
I will, but I also have a healthy respect of like just how much resistance is in me. Maybe I don't want to like get unzipped and like lose it or something. You know what I mean? I'm joking, but I'm not.
I love the smell of the I can't I might butcher this Impamtu.
Oh, in Pepo? Who knows how to
Impepo.
say it? Like that's how I'm
Yeah,
saying it. Yeah, but
yeah.
yeah, isn't it? It's really nice. Yeah,
Something about it.
yeah.
Yeah.
I've tried to get that for a few years, and I finally got my hands on it. Yeah, and it's not even crazy expensive. That's the other great thing.
Oh,
It was
it's
just,
not. I better
yeah,
check those things out.
it's like $20 or something. But
Amazing.
for what it does and everything, yeah, like very nice.
Get me a
Like, I
gallon of
was
that.
I was putting it on my shoulder instead of the terebinth for the fascial part. I
Mhm.
think I might like it better than terebinth, and I mean terebinth's been
Oh,
my jam for a while. Yeah.
that or CRC?
But that, well, I'm talking about for fascial, like for like
Oh,
my
for
bone and
that.
shoulder. Like I cover it with terebinth from time to time just because of the like with torn muscles, you get fascial restrictions all the time. And
Mm-hmm.
so, I put helichrysum on it from time to time, but I do a little bit more maintenance with terebinth, but I've switched over to the Mpepo and think I like it a little bit better.
Nice.
Yeah.
Thank you, Greg.
You're so welcome.
Good job, Sam.
It was exciting when you told me.
She is so
I better
proud of
try
herself.
that now.
She was like,
Let me go take my bath now.
look at how much I pooped up this bathroom. Boom.
Oh, funny.
Next
you,
time I'll
guys.
burn some incense after. And then go ahead, Denise, then David.
Hey, Denise.
Hi, Greg.
Hey, how
I
are you?
wanted, I'm okay, thanks. I have a bit of stress. Of course, we know that's been ongoing,
Uh-huh.
but it's caused a little bit of a cold. So I was hoping
Okay.
if you would check on that for me. And so stress, cold. And then my friend that she just is getting the lemongrass tonic, body tonic. And last week, I think it's probably her third chemo. They do it weekly. She
Right.
has, they had started her on week 2 of insulin because she'd been diabetic,
Yeah.
but she'd never been on insulin.
Right.
So the insulin and then the chemo, and then she's on steroids. And she said
Right.
she was just climbing out of her skin. Will the lemongrass body tonic help some of that?
It should help, but it's hard to gauge.
Okay.
With the chemo, they push the body to such extremes that there's things that you can say like, oh yeah, these are things to expect, and then there's just a bunch of weird things that happen because of some potential underlying issue that a person might have or a weakness in a particular system of the body. So you just start like observing and trying to keep everything as normal as possible, because really the thing that's going to make it better is to get through chemo and then not have it anymore. And
Okay.
so you try to manage the best you can as they're going through chemo and radiation. But it's like with a pregnant woman, like with a bad back, the thing that's going to cure that bad back is having that baby.
Right.
Not treating the back. Like you're trying to stabilize the back, but really the goal is to have the baby. And here the goal is to get them through the chemo. And so it can help, but let's have her start with that. And then if it doesn't bring,
Some relief.
yeah, then we can do another, something
Okay.
else. But we'll keep it real simple, but we'll really try to target that for her.
What can I tell her the lemongrass? How is it helpful?
Well, it's calming down the nervous system. It's pulling the person out of sympathetic part of the nervous system, which is fight flight, and making them go into rest and repair to a deeper degree. So it's calming to all the body systems, and it helps to relax things, and it tones the vagus nerve. And so usually that can be helpful, but again, I mean, part of the thing that I used to do when I was doing healings on people was I would, there's science and holistically, we look at like not having the person eat meat while they're going through their treatment and, their body has the cancer. Just because the meat activates the same centers in the body as what makes the cancer grow, right? So you're reducing it, but science says that animal proteins accelerate the growth, or chaotic growths in the body. And so there was that, but I would also have them not use corn, nuts, and soy. And the reason why I would do this is that people have weird reactions to the chemo, and about 1 out of 20 don't have an enzyme. They don't have an enzyme that breaks down the chemo. So at some point, they'll have a really bad allergic reaction. And as the histamine levels elevate in the body, you might not be allergic to peanuts before chemo, but going through chemo for a while, you might be allergic to peanuts, or corn, like those. So corn, peanuts, and soy are big across the board general allergens that people could ingest that are potential allergens, right? And so just while they're going through chemo and radiation, I would have them drop those 3 things the best that they could.
Okay.
It wasn't like, oh, this has a hard no. It's like try to avoid it,
Okay.
And just because if they go into an allergic response, again, not very predictable, but if they do, they don't have that has pushed them over the edge. And again, it's just because like when you start going through chemo, there are some things that are kind of predictable, and then there's some things that just anything goes. And so when you're dealing with some situation like this, you don't know what state the body was in and how the body's going to react. And so you start treating, and then you just start making adjustments. Lemongrass is a very good place to start.
Excellent.
But we could get really crazy with it, but I find that when people are in that case, I try to keep it really simple and just try to get them through it. And then, as they start having more energy, just rehabbing them after the fact. But
Okay.
this is a good place to start. And, I can't remember how many more weeks that she has, but goal is to keep her as comfortable as possible then. And then afterwards, we'll do a little rehab.
That sounds great. Thank you.
You're so welcome.
Okay, so the cold is sort of in my neck and head and my throat, my chest and throat. So and then just stress for me. Okay.
Do you have any like fir balsam, or like what do you have that's like a balsamy kind of substance?
I have a poplar balsam that's in more of a lotion you guys made up for me, which smells heavenly.
How about just taking some of that and rub it on your chest? Like shake it up really good and rub it on your chest. Do that 2 or 3 times a day.
Excellent. And then
Yeah.
bay laurel too, maybe?
Bay laurel or something that will have like a thinning effect on the mucus. Any sort of thyme, anula. What do you have that's like kind of a respiratory?
Well, and I wanted to ask you about that rosemary for
Verbenone?
Yes, I wanted to ask about that. I have thyme linalool and I have.
Yeah, why don't you try inhaling the thyme?
Okay.
Yeah.
And if I had ordered cedar once for my son, but I don't know if I have it. I don't think I do. Is there a specific type I would need?
Himalayan would be good.
Okay.
The Taiwanese works maybe a little tiny bit better, but Taiwanese is like 5 times the price. Just do the Himalayan.
The Himalayan.
It's not 5 times better. You know what I mean?
Thank you. I really appreciate you being mindful of that as well.
Oh yeah.
Okay.
Like if it was 5 times better, I'd say, oh, it's 5 times better, but it's not. It's maybe 0.3 times better. You know what I mean? For this application, no work.
Thank you. I'm still trying to save what little grocery money I have here and there to get to that tuberose.
Oh,
Sam and I talked about that when I
Yeah.
met her. Thank you so much, Craig.
You're
I
so
appreciate
welcome.
it.
You're so
And say hi to Sam. Thank you.
And then go ahead, David, then Megan.
Hey, David.
Hi, Greg. So this, some of the conversation brought up some more questions.
Mhm.
So I remember, I think you said lovage is a tonic for the kidneys, is that correct?
Yes. Yes.
And can I continue doing that as well?
Oh, yeah. If you're using lovage, rock on.
Okay, so 2 to 3 drops of each of these once a day,
Yeah.
not twice a day, right?
The lovage, I mean, you could do the lovage more, but the downside of it is it's going to make you pee more. And so I would say, like, do it more at the beginning of the day, so you spend your day peeing rather than your night peeing. You know what I mean? Like,
Yeah.
I've done that. It's not fun.
Yeah, okay.
Speaking of that, I think I need to make a little pee break too.
Okay, so after David,
Yeah.
go on.
Should I continue or you want
Yeah.
Okay. And then you talked about cedar over the 4 quadrants. Would Texas cedar work?
Yes, it would.
Okay, and the 4 quadrants, how do I?
So it's that thing where we go, okay, the whole left side of your body from the head down to the toe. So like your outside of your face and neck, your shoulder, your rib, your hip, down the outer leg and the outer ankle. So that's the left quadrant. And then down the front would be the face and throat and chest, abdomen. So you're using the body to anchor your attention so that you're affecting the aura. So you're doing the left side of the body, down the front side, then the right side, and then the back side.
How do you do the backside yourself?
You just you inhale it, and then you go, okay, back of the head, back of the throat, the back,
Oh,
the
So
hips.
this is inhalations, not topically applied.
Yeah.
Okay.
Yeah, I mean, if you apply it topically, it does that, but this would be inhalation where you're working the quadrants.
Okay. And then for me, is there a particular mushroom or mushroom blend? I've got all these powder mushrooms.
Mhm.
Is there anything you'd like me to?
For what are you trying to do?
All kinds of things. Right now, strengthen the adrenals.
Cordyceps.
Cordyceps. Okay.
Yeah. 3,000 milligrams or close to that.
Okay, great. Okay, super. That's it. Thank you so
Yeah.
much again.
You're so welcome. Yeah, let me run to the bathroom.
Well, Greg's away. I feel like there's things I should show you here. Or you guys could also take a quick break. All right, well, Greg's away for a quick second. For those of you who have been to our website, we've done some updates. Very exciting, and some of you may or may not know. So if you go to our shop page now, our categories are really, really nice and simple. And so if you're looking for a product, over here on the left, we have our categories. And so if you're looking for something specific like incense, you can go right to the category and you can still type in whatever one you want in the search and it would find it. But just in general, it's a really nice, easy way to find things. Our blog has also been updated in the last few weeks, and we're making that nicer and easier for you guys as well. We have all our different categories here and our properties of oils. If you get our newsletter, he highlights different oils every week, and this has all of our most up-to-date ones. And enough of that commercial break. Go ahead, Megan, then Jennifer.
Hey, Megan.
Hey, I like these commercials. I am so curious. I've read this, I think in Astara and also elsewhere that they're saying it is easier to process your emotions while you're still in the body, your body's still alive compared to after death. And I can't think why, because I would think when your physical body's gone, it would be easier. You don't have all the physiological conflicts going on.
There's that, but also because of that, it also makes it harder because it's all in your face all at once. So it becomes very easy to get overwhelmed when you leave the body. And so, say you're working through something difficult, you're working through a past trauma, for example. And you're working through it, and you're working through it, and it gets a little overwhelming. You can get up, walk away, turn the TV on, talk to a friend. When you're not in your body anymore, it's there, and there's no getting away from it. And
Okay, so
so
it's like harder emotionally.
it's just harder to process because it's just so in your face. Yeah. And so and the other component of it is that when we leave our body, there's always talk about, we're going to be judged, which is true, but it's mostly that we judge ourselves. And so it's not just that there's an emotion there, but there is a little bit more clarity, and there usually is the tendency to judge yourself a little bit more intensely than you did when you were in the body.
Okay.
So the judgment is you are judging yourself. Like that is the issue. Yeah.
Got it.
It's like being in a body is like you can process things like at a slower pace where it's like it's on a slow cook mode, like when you're out of your body, it's like, we're going to do this all right now, right here, right now. You are going to work through this right now. And we're not always ready for that.
Yeah.
Yeah. Yeah. It's an interesting thing. Like sometimes if you kind of have practiced processing things when you're in the body, you work through things kind of quickly when you leave the body. But if the person is not very hasn't practiced that a lot, it's not even so much how much you've cleared, it's about like being in this process of like, well, okay, I have an emotion, I got to process it, whatever it is. You get kind of in this like place where you can process things. You can work through it actually relatively quickly, so you take somebody who's been doing that kind of work, they might only be in the emotional body for, a short time, weeks or maybe a few months, where somebody who doesn't process that and was really rigid emotionally, when the time comes, it might take them years, sometimes even decades. It can take quite a while.
Yeah. Yeah. I watched this interesting thing on Netflix about kids who remembered their past lives and what they all had in common. Did you watch that?
No, but yeah, I've
What they
been
all had in common is they had a very traumatic death and they had not actually died very long ago. And it made me think, and they were children or very young, like one was a
Right.
pilot in World War II. And I thought sometimes I think I read if you pass when you're pretty young, you start your next lifetime a little sooner. And so it made me think if
Yeah,
they
it's
started
hard for
before,
me
they
to
didn't have
say.
time to process their death and they're very traumatized about their death.
Um, yeah, there's all kinds of theories about that. Like sometimes they'll say younger souls have less time in between incarnations. It would be hard for me to verify. Like I can tap into somebody who's passed usually, but if it's been a while, it starts to even get hard to tap into that. Like it's just, and so like I've seen kids like where they come through with remembering something from their past, but yeah, usually they had something intense happen like right as passing or right before they passed, that they kind of re-engaged very quickly. But they have crazy memories though, like weird details that they can really nail. But
Yeah, you might like this documentary. It's called Surviving Death. It's the very last two episodes of it with the kids, and they knew their name, and it was recent enough they could look this all up on the internet and verify all of it. So it was really interesting.
yeah, there was a
But
group like I don't know if it's those same kids, but there was a small group of kids in Southern California when I was down there, that same kind of thing scenario. And I did a couple of healings on a couple of them, but I couldn't tell you who they were.
yeah.
There was another group, I found this also very interesting, is that it was adults, and they had this fetish about amputating parts of their body. And it was always weirdly specific. Like they'd get a leg amputated that was completely healthy, by the way.
Oh my
And
gosh.
go, oh, it's 3 inches too long. It needs to be right here. Like it's
Wow.
not. And you stand there and look at them, and you just tap into clairvoyance. And it's like most of these are from the Civil War, and some of them are just from another war. Like it's just like they're remembering their war wounds, and they're trying to recreate the war wound that they had. And so most of these guys, it was almost all guys, by the way.
Yeah.
They look like they had just come from the Civil War, but with modern clothes. I mean,
Oh
it's
my
just
gosh.
they just had the same weird bandages, and it's that same phenomenon. Like
So then
they
why
just,
haven't they, yeah.
they
Like why
just
haven't we
remembered
processed?
yeah, certain pieces of it, and they get so fixated on that they weren't able to process past that. Yeah.
Yeah. So by like between lifetimes though, we just don't get through everything. We still come in with like our stuff.
Oh yeah, we all have things that we're carrying from the past. Theirs was just a bit more obvious,
Yeah.
but we all
So
got
like,
some,
yeah.
theirs, we could see them because they're missing a leg sitting in a wheelchair. But I guarantee like something that we do where we interact with certain people, or we view the world a certain way, or view ourselves a certain way, some of that's from the past. It's not from now.
Yeah. So like when I think about my parents who are not, they don't have any evidence they're close to passing, but it just crosses my mind. Should I just, because like one of them definitely just zero emotional processing, doesn't even have interest in, working through things and all that. Should I just chant Om Mani Padme Hum from time to time, or
Bless
should I
below
wait
their
till they
feet. Yeah,
pass and chant it, or
bless
just,
below their feet. Bless below
okay,
their
okay,
feet. Om Mani Padme Hum, either with a dorje or your hands,
yeah,
and bless below their feet.
okay,
Yeah, the
thanks,
best thing you could do for them.
okay.
And then go ahead, Jennifer, and then we have a couple questions
sure.
in chat too.
Hey, Jennifer.
Hi, how are you?
Good.
Good. One, I just wanted to thank you for tonight.
Oh, my pleasure.
Like I'm listening to the whole evening and I felt like you were speaking to, I think in the beginning, the first like hour, it was like, I felt like there was answer after answer for what's going on with Ethan and what's going on with Aiden.
Oh, good. Yeah.
And not that I have any idea how to put all the pieces together.
Yeah. Yeah.
But
Aiden showed me his X-ray. Yeah.
it's shocking. Like, and I feel like
Now had that been evaluated like say 5-10 years ago, or
it had been evaluated probably, and right now to put dates on a specific timeline, it's hard for me. So I don't want to give, but probably 6 years ago. And then we had been going along this idea that, what we were doing was working. And then when he got off the going to the endocrine doctor because we couldn't get a hold of the growth hormone. We started doing all of the other things that we're doing that we come to be doing now. And through a series of events, I was led to this chiropractor out in Denver who did the x-ray. And thankfully, and now he's in his hands. And so I feel promised that we're going to get back on the right track and be able to combine anything. At the same time, I mean, there's this just motivation. Like I can remember when I had Ethan, who was born with spina bifida, there was just this motivation within me, like everybody was going to get out of the way and that kid was going to be successful. And I feel like now it's like there's this motivation within me that's just like same thing, get out of the way and let's make sure that Aiden is successful with everything that he has going on. So I've just been working everything on my end, whatever I can do, like energetically, with the work that I do. And at the same time, like I have said before, like, I feel like all these different realities are happening at the same time, and they're all merging into the possibility that all of these things can still happen. Like Aiden can achieve what he wants to achieve. Ethan will bounce back, and like I will continue to grow with my process. And the craziest thing is, Greg, I'm getting like confirmation after confirmation with that. And at the same time, getting stronger and stronger in my understanding and my beliefs. I just want to stay like grounded in all of this and very, very real with what's happening. And so number one is I wanted to thank you for tonight, because I felt like there were so many pieces of the puzzle that were being put out there of possibilities with just the discussion of everybody else, and the different oils that just I started to go, well, that could be a possibility, that could be a possibility, that could be a possibility. So and as we're going along, you know, just this desire just to put it all together. So I know that you guys sent me an email about talking later this week, and I would love to take you up on that, because I have so many things that I want to express, and put the pieces together and kind of ask, you know, where I can go next with this for me, how I can best support on my end. I have an idea, but there's a lot that I don't know. And one was to say thank you. Two is to just confirm that I would like that to happen. And three, I don't know, just gratitude. I don't want to take up too much time, because I know you guys have to move on with other things on the schedule, but I just couldn't help myself. I wanted to share all that.
Okay.
So.
Well, thank you. Yeah, and we'll come up with a strategy. You know, I was focusing more on his endocrine function and everything, and knowing that you guys were seeing a chiro and all that, and it sounds like he's seeing a good chiro now, and you know, yeah, we can talk about potentials and everything, but I'm sure the chiro has very different ideas on things that he can do to help with that. So. Yeah,
they're very much placed on structure, and I can talk to you about what's going on with that when we talk. And then the other piece of it is just to bring up, there's a lot of things that were mentioned tonight about that I could see could be applied to Ethan. Just my just the stuff that was coming to me as things were being discussed.
Okay.
I don't know. I mean, I could be way off, but anyway, so
Well,
I
we
just
can
want,
talk about a protocol for
yeah,
both.
yeah. So that'd be great. And I know you're seeing him on Friday too.
Yeah.
So, but okay, that's it. Thank you. Anyway, thank you for
Yeah,
everything.
thanks for
both of you
sharing.
do.
Yeah, thanks for
So,
sharing.
okay.
And then go ahead, Priya, and then we'll do the other.
Hey, Priya.
Hey, how are you?
Hey, hey.
My doctor brought up a medicine for me for ADHD, and I have taken this medicine in the past, and it has its pros and cons, and the cons are way
What's
bigger.
the name?
So he's tried all other stimulants, but it's called Duramine. And Duramine if I look it up, the chemical, I'll just give me one sec. Uh, Fentanyl.
Okay,
Fentanyl.
I'll still have to look it up.
Yeah, so what it does to me, I get so much focused and concentration wise, it's absolutely spot on. Like I'll start reading something and I'll read it for an hour with 100% concentration.
Mhm.
But it brings me to the edge. It makes me impulsive, reckless. I am so full of energy. I
Yeah, so
talk
it's a stimulant. Yeah,
way more than
it's a stimulant.
Sorry, my internet was playing up a little bit and your voice
It's
is
it's a stimulant.
it's a stimulant, yes.
Yes. Okay. Mhm.
It's a stimulant and it stimulates me. It's a appetite suppressant also. So I don't feel hungry, but I'm so full of energy. And then the first I took a pill few days ago. And the first book, randomly, I grabbed a book, and it was Biology of Belief by Bruce Lipton. And
Mhm.
randomly, I opened a page, and it was all about the side effects of the medicines and how the chemistry of the brains. And there are so many people who die because of the adverse effects of the prescribed medicines and stuff like that. So I like, and then everything that Melissa does for me, it calms me down and it keeps me balanced and normal. It this medicine taking it just completely does total opposite. My heartbeat is my blood pressure rises, but concentration is great. Nothing else gives me the level of concentration that this medicine does. So it's
Yeah, but
like
like you said, there
this
is a
way
price to pay,
or that way.
and
And if I
the
take this, yes, I can study and I can concentrate and I can do everything great. But yeah, which is big, which is like it takes away so much more from me than it gives me. So I had my first dose after a very long time. I had it on Thursday, the day before the healing session with you. And I could feel it later on that maybe that's why I was the way I was because of that pill. And so I did not take it for a couple of days and then I just took Melissa. Now I feel so calm and I feel relaxed and I could go to the uni today and I could be around people and not be so jerky. But then I can't concentrate that well. So it's like,
yeah.
what do I do?
Let's have you like do you have let's have you use a couple of different oils. Do you have cinnamon?
I've got cinnamon.
Yeah. So and are you taking that daily or no?
I stopped when I started taking this pill because I
Okay.
was like,
Let's
I'm
have you take that, and then the other thing is basil. Do you have any form of basil?
I've got basil. Yeah.
Yeah. And so let's have you do 3 or 4 drops of basil, like twice or even 3 times a day. Like let's maybe do twice, see how that treats you, and then if not, and the idea, it might not do it right off the bat, but used consistently, it is a mental like stimulant. It is a thing that strengthens and fortifies the mind and the cognitive functions. And the combination of the cinnamon and the basil being taken at the same time might be able to duplicate that, but without the side effects.
Yeah, okay. I will do that. So after our session, because of how I was,
Mhm.
I did it just I was just going through all of my kits and I was like, what do I do? Because I was just all over the place. So
Sure.
I did the brain waves, the beta protocol, the brain
Mhm.
waves
Mhm.
class. And that brought me back to balance a little bit.
Okay.
I could attend the classes again on Zoom and stuff like that because I was not even able to do that
Right.
initially. So that brought me back. But yeah, I have not been doing anything else much. Like
Okay.
creativity has just gone out of the window. And so I'll start off with cinnamon and basil and
Yeah.
yeah.
Do it
Thank
for like a like 3 or 4 days or even a week, and then let us know how it's working.
you. No worries. Thank you.
You're so welcome.
For the cinnamon, how much was the application for that?
Like maybe 2 drops taken internally 1 to 2 times a day, but then inhale it a bunch.
And then earlier you were talking to somebody about the like constant thoughts and things like that. Would quiet mind help?
It would if it's endocrine related. Like if it's not endocrine related, it probably won't help. So I don't know that that person's issue was endocrine related. So that's why I didn't mention.
Yes. And then can you speak about the upcoming class, generational healing?
Which one?
Generational healing.
Generational healing. So we are going to go through and treat what we call generational healing. And basically we're treating the influence of the mother side of the family and the father side of the family as it impacts our energy body, how we process that information, and how things become like emotional patterns and mental patterns and behavioral patterns. And we go through and like gently like unwind it, shift it, so that you get to be a little bit more of who you are rather than just the byproduct of generations of behavior that you're kind of stepping into. And so it's a way to systematically, we're going to mechanically and systematically go through the different parts of the aura, talk about it like from the point of view of the structure, of the function, and then the quality of the auras. So there's like these different kinds of layers that we'll go through and address. Will stimulate the ability to move things to a higher degree, and then we'll break up our connections with the family, especially the negative influences, but to a much higher degree than what we've done before. Like, sometimes we do it with etheric chords, or we do some visualization or materialization. This is all of that on steroids. And so the tendency is to actually access things that are past life issues that are in the intuitive mind that we're playing out, or the karmic imagery, but also the both the energetic and genetic influences that have happened from our families, and then also how that's affected how our energy bodies process and function. And so we're going to go through and just manually unwind all this. And this class, we've kind of done this a few times before, but this time we're doing it with intention. We're going to do this class, right? And then we're going to do, how we do a 2.0 or some version of that where we go, same kit. And if you've had the class, it's a free review, but we're going to do some different stuff. We're going to do 3 other classes associated with generational healing, that once you've done the first one, you paid for the first one, 2, 3, and 4, and possibly even 5 are just going to be considered like review or study group, but we're going to do them through a whole weekend. And so we're turning it into a little bit more like it's like a class you're taking at school, because like sometimes try to cover as much as I can in the weekend, but there's only so much we can cover in a weekend. So this putting something forward, and then we're just going to follow it through for 3, 4, 5 weekend sessions to go through and really unwind it. And so it would be more than just generational healing. That's what's getting addressed. There's going to be a lot of unwinding for all kinds of things, be it protection, intuition, this healing, psychological healing, and then also your mystical practice. So yeah, so targeting that stuff that that we come in, there's good things from our family, and then there's things that are not so good, and we get to kind of wash some of that stuff away.
So it's a series?
Yeah, it's going to be a series. Like you pay for the first one, the other 2, 3, and 4 will all be just part of the package.
Will people have to
And
do them in order?
nope, no, don't have to do them in order. It's it's a very big kit. It's a $300 kit, but it's the kit being made so that when you do version 2 and 3 and 4, you have the oils that you need for every step of the way. So
Can Greg speak on rosemary verbenone?
is there anything in particular you want to know, or just in general? Or?
Greg, I thought you said that it helps to break or unwind or break up chaos. Is that right? Did I understand that correctly?
I was probably talking about shifting the state of the body with cedar. Rosemary verbenone, it is very good for kind of calming down like a chaotic thing going in the body. Like when you're treating something and the body's just so out of whack and you're like, God, I just don't know what to treat first. Rosemary verbenone can calm things down so that you see a clearer path to what you need to go treat. It's very fortifying. It moves blood up to the brain. It's incredibly good for the liver, and it's also very protective, like a protective quality, and so good for reducing stress, good for improving digestion. It's good over a period of time to reduce the stress in the respiratory tract and the production of mucus in the respiratory tract. And so you can use it in a lot of different ways, but yeah.
Thank you. And
So-
I actually have Texas cedar. Would that be okay
Yeah,
for
yeah.
me to use?
Yeah,
in the
yeah.
interim?
Yeah, yeah.
Thank you very much for this evening. I
You're
appreciate
so
it.
welcome. Yeah, you're so welcome.
Is astral projection blend, will it be in the generational healing class kit?
Yes, it will be actually.
All right, and we have some time.
We have a little bit of time. So let's see. Let's still do the advanced Moses technique. So let's have you pull out hyssop or sage. And if you don't have that, we'll give you some choices, but let's try hyssop and sage first.
Hyssop or sage, you said?
Mhm.
Okay. I don't know if you said this, sorry, someone's asking a question. Which class offered a double size of the oils?
Never said that. I don't know what that,
They said it was about 12 to 18 months ago.
I don't know.
Yeah, sorry, I don't know either.
Yeah, I don't even know what that means. Maybe just bigger bottle.
That's what I'm thinking.
Okay. So whatever you want to have healing on, be it a part of your body, emotions, mind, or a prayer you'd like to offer up, reflect on it with your awareness on the center of your chest. You're not even inhaling yet, you're just reflecting. And then let that go. Your awareness is on your back heart, the area between your shoulder blades, and you're taking nice, long, slow, deep breaths with your awareness between your shoulder blades. Nice, long, slow, deep breaths. Move your awareness down to the navel. Your awareness is on your navel. You're taking nice, long, slow, deep breaths. Move your awareness an inch and a half below your navel. Now, shoot it from that area, the navel minor, inch and a half below your navel, go through the body to the Ming Men, the low back area, the back side of the navel. So go through the body to that low back spot. Now, float it around, like just move your awareness around the outside of your body, coming all the way back to your navel. So from the low back, go around the outside of your body, resting again at the navel. Long, slow, deep breaths on the navel. And then your awareness is on the crown, the top of your head. And then just pause and be still. Just pause and be still. Again, your awareness is on the back heart, the area between the shoulder blades. You're taking nice, long, slow, deep breaths. Down to your navel. An inch and a half below your navel. Now move through your body back to that low back area. That's the back side of the navel. And float it around the sides. You're floating it around the sides all the way back to the navel. And then up to the crown. And then just be still. Just be still. Just let go. Just let go. Let's try to squeeze in one more round. Back heart. Nice, long, slow, deep breaths. And then down to the navel. Inch and a half below your navel. Now shoot it back to the Ming Men. Shoot it back to that low back area. So through the body, coming out that low back area. Let it sit in that spot for a moment. And then float it around your sides, back to the navel. And then back to your crown. Your awareness is on your crown. You're taking nice, long, slow, deep breaths. Just let go. Hey, you guys, thanks for joining us. Wednesday night is, what was the class we just did? The Mystic Toolkit, right? Check me on getting it right. So we'll be doing the Mystic Toolkit study group tomorrow night, but this weekend, I think, is a review for most of you, navigating the body map. And is that what it's called?
Body mapping in the three brains.
Body mapping in the three brains. I'm not reading the memos, apparently. And we're going to be doing a bunch of work for astral projection in this. So I would say, which is tied to emotional healing, mental healing. So join us if you can. And if not, maybe we see you next Tuesday. Take care, you guys. Join us for a star right now if you can.